Now, how effective has the government's vaccination communication strategy been? What are some of the loopholes encountered during the first phase of the vaccine rollout? For more on this, I'm joined by Chris Vick, chairperson of the communication network COVID Comms. Good to have you, Chris. Thank you for joining us. You've been in the communication fields for decades, Chris. So what's your view on how rollout communication is being handled at the moment?
I think the important point to make is we have one of the most elaborate vaccine rollout programs in the world. I mean, government has opted for a very sophisticated, very intricate system that has different phases, healthcare workers, over 60s, 45-year-olds with comorbidities, etc. And because of that, because of the intricacy of the rollout program, the communication is not only particularly important, but also equally intricate. The fact that people have to register, then receive an SMS confirming their registration, then get a message confirming that they're going to get a vaccination, and then get the ticket that allows them to have it. I mean, that is incredibly elaborate. And I think government has possibly bitten off more than it can chew in terms of the scale of this. I often compare it to running an election. If you think of how complicated our voter registration processes are, and that's for one election, you've effectively got 4 of those going on with different technologies, people having different levels of access to technology. And I think because of that, the government communication sometimes comes across as a bit patchy. There are good points and there are bad points. But also that the communication has tended to be very urban and focused on people who have got smartphones and do have data, which is a problem because I think the people who need these vaccinations the most are the ones living in areas which we would describe as information poor.
You're quite right. Let's take up exactly that point. Very smart, WhatsApp, online registration. What's missing for me, though, is the detail. How many vaccines available for people in the coming week? How many per day will be vaccinated? When can we start with 60-pluses? When do we end the 60-plus phase and start with those under 60? All of that is missing. And, of course, what we need as a population, as citizens, right now, because we're all vulnerable, we're afraid, is confidence. Is confidence that everything's being taken care of and is under control. That's not happening, is it?
Well, there's been a trust deficit since the beginning. I mean, I think the way vaccines were procured was quite problematic, and the way the rollout started was quite problematic. But I do think things are changing. Monday is a very, very big day for anyone over 60 who's registered. I know the provincial governments are planning very high visibility vaccinations from Monday onwards. And I think the detail will start to come out there. But I mean, our sense as COVID Comms is people are not necessarily stressing too much about whether they're going to get Pfizer or J&J or some other. They just want to know how to get that vaccine. And I think it's the primary information that most people are looking for.
All right, on eNCA yesterday, I heard a doctor from Baragwanath saying we have to start slowly. Today we heard the MEC for Health in the Western Cape saying if we move too quickly, the system may collapse. What message does that send to ordinary people about how competent we are around what is probably the most important project in a century?
Well, I think it compounds the trust deficit, and that's the difficulty. But again, it is partly because you have people speaking at national government level, provincial government level, and I've even seen communication coming from municipalities and district municipalities, which gets issued out on a WhatsApp group and then gets withdrawn because it's factually incorrect. I think the difficulty is people are working at great speed. As I said at the beginning, it's a very intricate, very complicated rollout process. It could have been done much simpler. It hasn't. And I think the best government can do now is to provide that primary information around who gets it, when they get it, where they get it, and how they get it. That's really what we need to empower people now, particularly those in rural areas and who don't have access to things like eNCA and TV stations of that nature.
Thanks very much, Chris Vick, chairperson of the COVID Communications Committee.